It's a pleasure to be able to speak to you today. It would be an even greater pleasure if we were all able to gather together. But perhaps it relates to one of the two themes that are important, which is if you ask people, what are the big problems in the world? You get two answers: climate and inequality. I'm going to say more about inequality than I am about climate, but we need to deal with the two of them at the same time. Let me say a word about health and why it's appropriate not just for people concerned with health care to be concerned with health, but for the whole of society. I think there's a good case to be made that the level of health of a population tells us how well that society is doing. And the level of health inequities, the systematic, avoidable inequalities in health between social groups, health inequities tells us something fundamental about inequities in society. And then we get the pandemic. And the pandemic exposed the underlying inequalities in society and amplified them. I've been responsible for two reports that we produced in the last 4 months, both with the title Build Back Fairer, not Build Back Better, Build Back Fairer. The second was the report of the Commission of the Eastern Mediterranean region of the World Health Organization, and we called it Build Back Fairer. Action on the social determinants of health is vital to improve health and to get greater health equity. And the other report was for England. We had documented what was going on with health inequities before the pandemic. Then, as I said, the pandemic exposed and amplified those inequities. And as we emerge from the pandemic, we need to build back fairer. Now, there is rightly a great deal of discussion about equity in the distribution of vaccines globally. Absolutely right that we should have that discussion. It should be a high priority to get equity in the distribution of vaccines. But that won't solve the problem of inequities in health. In Britain, where we have very good data systems, what we showed was the so-called social gradient in mortality. And by that I mean the more deprived the area, the higher the mortality. The social gradient in mortality from COVID-19 was almost exactly parallel to the social gradient in mortality from all causes of death. COVID-19 is caused by a virus. The major causes of death pre-COVID-19 are heart disease and cancer and chronic obstructive pulmonary disease and diabetes. They're not caused by a virus. And yet the social gradient in mortality from COVID-19 caused by a virus is almost exactly parallel to the social gradient in mortality from all causes. That means that the causes of inequalities in COVID-19 are really rather similar to the causes of inequalities in health more generally. When I say the pandemic exposes and amplifies the inequalities, it amplifies them because the societal measures taken to deal with the pandemic exaggerate the inequalities. We see with the lockdown in schools, the educational divide expands globally. Children from more advantaged backgrounds or in richer countries have internet access, better conditions at home for remote learning, and children in more deprived backgrounds, less good conditions at home for remote learning. We look at what happens to occupation. And again, we have very good data from the UK. And what we see, the higher the income, the less likely are people to be working in an industry that got closed down. The lower the income, the greater the likelihood of being in a shuttered industry, one that closed down, or having to go out to work and be exposed to the virus, frontline exposure. I want to make a link between what was going on before the pandemic and what happened during the pandemic. Let me take the example of two countries, my own, the United Kingdom, and the United States. In the decade leading up to the pandemic, the improvement in life expectancy slowed down. In the UK, we saw a slowdown in improvement in life expectancy, an increase in inequalities by level of deprivation, and life expectancy in the poorest areas was going down. And in the US, life expectancy went down 3 years in a row. Inequalities increased, and mortality increased, particularly for poorer people. Not a good situation pre-pandemic. And remember my starting proposition that the health of a society tells us something fundamental about how well that society is doing. And I would say in the case of both of our countries, the UK and the US, weren't doing very well. Then came the pandemic. And those two countries that I've just mentioned, the UK and the US, had high excess mortality during the pandemic. What's the link between what was going on before the pandemic and the poor management of the pandemic? And I think the link works at potentially 4 levels: the quality of governance and political culture, increasing social and economic inequalities, disinvestment in the public sector and public services, and the fact that the countries didn't have very healthy populations to begin with. All of these have to be addressed. Now, let me turn attention briefly to the Eastern Mediterranean region. As I said, we produced a report called Build Back Fairer for the Eastern Mediterranean region. What we see in that region, as in other regions of the world, is the so-called Preston curve linking national income per person to life expectancy. At low levels of national income, a small improvement in income is associated with a relatively big improvement in life expectancy. But once national income, adjusting for purchasing power parity, gets up to the level of about $20,000 per person, further increases in national income are not associated with increases in life expectancy. You can go from Jordan, Tunisia, all the way out to Qatar, which is one of the richest countries in the world, and there's very little difference in life expectancy. So we talk about do something, do more, do better. If you're a poor country, in whatever region of the world, doing something will make a difference. Increased enrollment in primary education, providing good sanitation will make a difference. Do more if there's good enrollment in primary education, completing secondary school. If there's good sanitation services, dealing with the problem of intimate partner violence, dealing with that issue. We don't just want people to have clean water. We want women to have the human right not to be physically abused by their intimate partners. So do more and do better, looking at the rich countries of the Eastern Mediterranean region. Their life expectancy lags behind where it should be given that level of national income. Deal with tax avoidance by multinational corporations. Invest further in the education of populations. Do something, do more, do better. As we come out of the pandemic, we need to address the structural drivers of health inequities, economics in the Eastern Mediterranean region, the causes and consequences of conflict, the climate crisis, the nature of culture and society. We then need to address the conditions in which people are born, grow, live, work, and age, and the systems of governance, respect for human rights, that allow us to address these social determinants of health. Fundamentally, though, we need to call on all governments to put at the heart of what they're trying to achieve equity of health and well-being. That should be the basis for government policy, not simply economic growth, but equity of health and well-being, dealing with climate change, dealing with inequality, and creating fairer, healthier societies. That's the way to build back fairer.